If you're looking to do everything you can to save your thyroid, in addition to listening to my podcast, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or thyroid. And there will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit SaveMyThyroid.com/newsletter. Hey, this is Dr. Eric, and in this Q&A episode, I am going to answer the question, can hyperthyroidism cause liver dysfunction? And I'm not talking about people who are taking antithyroid medication, as this without question can affect the liver enzymes. I'm specifically referring to the elevation of thyroid hormones. So I referred to 3 different journal articles, and I'll make sure to include the links to those articles in the show notes, which you can check out by visiting SaveMyThyroid.com. The conclusion was that liver dysfunction associated with thyrotoxicosis, again, hyperthyroidism is a common finding in clinical practice, although the exact mechanisms aren't known. There are both direct and indirect causes. And so I actually took my own notes. I'm not looking at any of the journal articles now, just look at the notes that I took. And it was really one main journal article from 2022 that I got most of the information from. It says that the reported prevalence of liver biochemical abnormalities in patients with untreated thyrotoxicosis, so again, those with hyperthyroidism who are not taking any antithyroid medication, the prevalence of liver biochemical abnormalities varies pretty widely. It ranges from 15% to 76%. And then it mentions the suggested causes of liver dysfunction include direct injury to the liver, comorbid heart failure, associated autoimmune conditions, especially in the setting of Graves' disease, pre-existing liver disease, and of course, medications, including antithyroid drugs. And then it goes on to say that liver enzymes can return to normalcy in as many as 77 to 83% of patients once the initiations of antithyroid medication is started in a timely fashion. Antithyroid medication, without question, can cause liver dysfunction, can cause elevated liver enzymes, but so can the hyperthyroidism itself. And what this is saying, if someone has elevated liver enzymes due to hyperthyroidism, again, untreated hyperthyroidism, but then they take antithyroid medication, that could help with the liver dysfunction. Now, in some cases, it would actually make it worse because in some people, antithyroid medication, whether it's methimazole, carbimazole, PTU, can also affect liver enzymes. Now, there's not going to be any research that shows that natural antithyroid agents can also have a positive impact on the liver enzymes, but that is true. I mean, it's really just about lowering the thyroid hormone level. So conventional medical doctors typically will recommend antithyroid medication, but as many of you know, when I dealt with Graves' disease, I took herbs. I specifically took bugleweed. I also took motherwort, but bugleweed is the main herb with antithyroid properties. Taking L-carnitine in higher amounts, 2,000 to 4,000 milligrams, according to the research, can also block thyroid hormone entry into the cell. And so taking bugleweed and our higher amounts of L-carnitine can lower thyroid hormone levels, which in turn can help with liver dysfunction that is caused by the elevation in thyroid hormone. So let's look more into the research. A recently published systematic review and meta-analysis showed that between 55% and 60% of patients with untreated hyperthyroidism had at least one abnormal liver function test. Now, which tests are affected? So here it measures ALT, alanine transaminase, which is ALT, aspartate transaminase, which is AST. So ALT, AST, you can find these on a comprehensive metabolic panel. These both can be impacted by untreated hyperthyroidism, as well as antithyroid medications such as methimazole, alkaline phosphatase, which I'll talk more about that shortly, total bilirubin, as well as GGT, which isn't as commonly tested, but GGT is another liver enzyme. And actually, I do recommend for people to test that. And so what it says here is that rises in alkaline phosphatase and GGT are seen in about 64% and up to 62% of thyrotoxicosis cases, respectively. However, what's important is that elevation of alkaline phosphatase is typically due to increased osteoblastic activity and driven mainly by bone isoenzymes. So what this means is when you do a comprehensive metabolic panel, and if you have hyperthyroidism, and again, let's say it's untreated hyperthyroidism, so you're not taking any antithyroid medication, you're not even taking any natural antithyroid agents, so the thyroid hormone levels are high, you very well might see elevated liver enzymes. Again, not everybody. A good number of people don't have elevated liver enzymes with untreated hyperthyroidism, but you might see elevated AST, ALT. Bilirubin isn't a liver enzyme. I have other episodes where myself and guest experts talk about bilirubin, and then GGT. So you might see one or in some cases all of these elevated. Alkaline phosphatase, this is very commonly elevated. Most people with hyperthyroidism, especially when it's moderate to severe, will have elevated alkaline phosphatase. And it could be related to the liver, but in most cases, and this is what this journal article is saying, most cases it's actually due to the increased bone turnover related to the hyperthyroidism. And this is a big reason why you want to lower the thyroid hormone levels, because in addition to the stress put on the liver, it could also affect the bone density. And the thing about the liver, it regenerates pretty quickly. So if someone has AST or ALT levels, or both of these, let's say are in the 40s or 50s, some people will look at these and be like, oh, wow, my liver enzymes are high, and they'll be really nervous. But the liver is really good when it comes to regenerating. It's not that I'm not concerned at all when I see elevated liver enzymes, but I've seen liver enzymes in triple digits, over 100, in some cases over 200. And then I'm very concerned. When it's in the 40s or 50s, I'm not as concerned. And it's typically not going to cause permanent liver damage at those levels. When you lower the thyroid hormone levels and the liver enzymes are normal, everything is great. So I'm not concerned at all about the liver enzymes. But that's not true with the bone. So if you have elevated alkaline phosphatase for a number of months, which is common with hyperthyroidism, and that in turn leads to osteopenia or maybe even osteoporosis, so again, lower bone density, once the alkaline phosphatase is normal, that doesn't mean the bones are normal. Well, if you have developed osteopenia, for example, you still will have osteopenia. So I'm actually more concerned about the bone density in many cases than the liver. But obviously, we want everything to be looking good on a blood test. And then it also mentions it is observed that patients with hyperthyroidism and heart failure exhibit more severe liver dysfunction, as well as like deep jaundice, so those bilirubin levels being higher, and then other things like hepatomegaly than those without heart failure. So essentially, if someone has an underlying heart issue, they are more likely to experience more severe liver dysfunction. So if you see those liver markers or even the bilirubin really high, again, it doesn't mean someone has heart failure, but maybe in some cases you could suspect. I mean, bilirubin, again, there's a couple of podcast episodes where I have experts talk about bilirubin that relates also to bile metabolism, the gallbladder. And there could be other reasons why someone has really high bilirubin levels, such as a condition called Gilbert syndrome, which is genetic. So again, I want to put you at ease as I'm talking about heart failure now. Again, most of the time that's not going to be the case, but in some situations, something to consider. And then it also goes on to say that other autoimmune conditions that could affect the liver, so not just Graves, not just the hyperthyroidism associated with Graves' disease, but there's a primary biliary cirrhosis, and then also autoimmune hepatitis. So again, this is when you might see the liver enzymes in triple digits, over 100, maybe over 200 or 300. And that's definitely not something to take lightly. And then here it says it's estimated that the incidence of antithyroid associated hepatic dysfunction, so liver dysfunction caused by taking antithyroid medication, is between 0.1% and 0.2%. which seems really low. I think it is higher than that. I mean, it just seems like my experience. I've been working with people with hyperthyroidism for over 15 years now as of recording this. And I wouldn't say like 50% have elevated liver enzymes that are taking antithyroid medications such as methimazole, but seems like it's a lot higher than 0.1 or 0.2%. And so I think that is it. Again, I'll make sure to include those links if you want to learn more. But essentially, that is my answer to the question, can hyperthyroidism itself cause liver dysfunction? And the answer is yes. So while antithyroid medication can also cause liver dysfunction, untreated hyperthyroidism can also cause elevation of the liver enzymes. And so that includes, again, AST, ALT, GGT, and then other markers such as bilirubin, alkaline phosphatase. Again, I have episodes on pretty much all these. I don't think I have a separate episode on GGT, so maybe I'll have a future episode, but I'm sure I've mentioned GGT in other episodes where I talk about the liver. As usual, I hope you found this Q&A episode to be super valuable, and I look forward to catching you in the next episode.
Thank you for listening to the Save My Thyroid podcast. If you haven't done so already, make sure you hit subscribe to stay up to date on the latest thyroid health-related topics. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. Thanks so much for tuning in.
I want to let you know about a product called Hyperthyroid Supreme, which is a unique supplement that has a rare combination of N-acetylcysteine, also known as NAC, milk thistle, and schisandra to support the liver. And it also has a few mushrooms that can help support the immune system, including cordyceps, which has both immune modulating and adaptogenic properties and is great for those with Graves' disease and Hashimoto's. To learn more about Hyperthyroid Supreme, visit SaveMyThyroid.com/liver support.